Hi, I'm pharmacist Sama, and this is an educational lecture from the IV Admixture Unit at the Pharmaceutical Care Department. I need your full attention, please. It's only about 15 to 20 minutes long lecture that will be hopefully useful for you in IV medication handling. Safe practice guidelines for nurses on the IV medications preparation and administration. By IV medications, we mean intravenous or injection that goes directly into the vein. IV medications are clinically advantageous due to their immediate therapeutic effect, but unfortunately, at the same time, harm can easily result from these IV medications. IV medications compatibility, or even at any time, we have to check three things in each medication: stability, compatibility, and light protection instruction. Compatible means capable of being mixed and administered without undergoing undesirable chemical and or physical changes. Incompatible, the reaction between drugs that after mixing are no longer safe or effective for the patient. Characteristics of incompatibilities are color change, hazy appearance, and precipitation. But we have to know that sometimes not all incompatibilities are dangerous. Some are just normal, such as in the color change, Tinam or imipenem, the antibiotic, may show some color change but not a sign of incompatibility, as long as it's mentioned by the manufacturer company. Types of injections. We have multiple types of injections: intramuscular, subcutaneous, intravenous, intradermal, and etc. In each type of injection, we have to know the limits of injectable amount of solution. For example, in intramuscular and subcutaneous, it's limited to be from 1 to 3 in children and from 1 to 5 cc in adults, depending on the weight of each patient. The difference between intravenous or IV push and IV infusion is that in IV push we have to give it immediately, one time dose drag into the bloodstream, but in the IV infusion it's over time, such as the pump infusion and the drip infusion. Most of you must be familiar with this drip infusion. It's the regular IV fluid bag that depends on the gravity, but pump infusion it's more electronically. According to the American Society of Health System Pharmacists, in compounding sterile preparation, in some cases it can be prepared out of the sterile environment, out of isoclass 5 environment, unless there was hand hygiene according to CDC recommendations and following the aseptic technique. Medication preparation. The preparation is an important part of the medication administration process. Preparation includes selecting the medication, calculating the right dose, mixing, and labeling. Medication needs to be prepared as close as possible to administration time. Medication should be kept labeled until the time of administration. It's important for the same nurse to carry out all the steps of medication administration as much as possible to decrease the risk of error. At the time of medication preparation area in nursing station, there is some requirements such as existing of sink, water supply, illustration instructions for hand hygiene and how to withdraw from vials and ampules, instructions, clean counter for preparation, full personal protective equipment for the nurse who prepare the medication, disinfectants such as 70% isopropyl alcohol, IPA, sharp containers, spill kit, and portable eye wash. Preparation process instructions. We must assure that compounding of all sterile products done under strict aseptic technique. In nursing stations, all sterile products should be prepared in a clean and safe area in the medication room. Please, no rush, avoid disturbance, always double check and don't underestimate any question. Please feel free to ask your colleagues, your pharmacist, or even your doctor. Do not hesitate to ask about any question, no matter how tiny the question was. Products used during the preparation must be always sterile and handled in such a manner as to prevent contamination. Eating, drinking, or using any electronic devices is prohibited while preparation. Talking should be minimized during aseptic preparation. All IV preparations should be double checked. Aseptic technique. In hand washing, to minimize the number of particles, we have to know the most frequently missed parts in the hand. As you see here, the green uh, pointing to the frequently missed parts of the hand, and these darker spots pointing to the most frequently missed parts of the hand. Also in here, here's the frequently missed and here the most frequently missed. Wash your hands and forearm with antimicrobial cleanser. Clean and disinfect the preparation area with 70% IPA spray disinfectant. Wear sterile gloves, gown, mask, and covering forehead and facial hair, please. Mathematical calculations should be performed before initiating the compounding process. The service of ampoules, vials, and container closures, such as vial stopper, should be disinfected by swabbing with 70% isopropyl alcohol before being used. Aseptic technique should be used to avoid touch contamination of sterile needles, syringe parts, plunger and syringe tip, and other critical sites. Solutions of reconstituted powders should be mixed carefully, ensuring complete dissolution of the drug with appropriate diluents. Needle entry of vials with rubber stopper should be done cautiously to avoid the creation of rubber core particles. Properly labeling patient and medication name, concentration, preparation time, date, and who prepared. Properly dispose used gloves and syringes. Clean the work area after finishing the preparation. Needles are made of stainless steel or aluminum. The length ranges from 3/8 of an inch to 6 inches, the length of the needle, and come in gauges ranging from the 30 to 13. Higher the gauge, smaller the lumen. Needles must be discarded in a designated sharp container. There is the three types of filters and sizes. There is the 5 micron, filtrate the drug of any particulate matter such as glass particles and rubber. It's a one-way process, either to draw up medicine or administer the medication into the bag. Once we withdraw the medication, we change the needle to injected or administer the medication into the bag. The second type is zero point 0.2 micrometer. To remove bacteria and produce a sterile solution, we commonly use it with IV fluids and the total parenteral nutrition bag. 1.2 for larger particles, micrometer for lipid and large particles, as you see here. Syringes Two types of syringes. We have the glass syringe, which most expensive and rare. Plastic syringe, less expensive, disposable, and sterile. Syringes. Here's the anatomy of the syringe. The plunger and the tip of the syringe must keep sterile and not be touched. Here's the plunger, and all the way inside, it's called the plunger, and here's the tip of the syringe. These two are considering as critical area of the syringe. We must, at any condition, we must not touch it. One must use the smallest syringe which can hold the desired amount of solution. When you want to withdraw 2 ml, you preferably use the 3 ml syringe or 5 ml syringe at least. But if you use a 10 cc syringe, it will be a wastage of time and money, of course. Vials. Vials powders are reconstituted by introducing a diluent, such as sterile water for injection or any other compatible diluent, of course. Vials are closed system. The amount of air introduced should be equal to the volume of the fluid removed. It will be illustrated later. An exception to this guideline is the withdrawal of cytotoxic or chemo drugs from vials. As you see, we here open the vial. Of course, swab it with alcohol swab, let it dry, and inject the syringe with withdrawing the needed amount of the air in 45 degrees into the rubber. Tilt the vial upside down to withdraw the needed amount. Don't forget to write the name, date, and all instruction or prepared by. Here's the full instructions. Remove and properly dispose of the needle. A new needle will be attached at the time of injection into the patient. Do not forget, at the time of administration, a new needle will be placed. Ampoules. Tapping to move the fluid down from the neck of the ampule. Swab it with alcohol swab. At the same time, you can work it with the same swab or use another gauze. Then neck snapped away from your hands. In time of withdrawing from ampules, we use 5-micron filter straws or filter needles according to the medication manufacturer instructions must be used when withdrawing contents. Do not reuse at any time during the compounding process. It's a one-way step. Here's the full description of ampules breaking and withdrawing. Last but not least, the 10 rights of medication administration. Right patient, right medication, dose, route, time and frequency, right documentation, right assessment, right evaluation, even the right to refuse taking medication, right patient education. For all information regarding any IV preparation, please check the Injectable Medications Manual and Guidelines. And also you can go to the Ministry of Health General Administration of Pharmaceutical Care to find that IV manual. It's full described with all ages and all conditions on the Ministry of Health main website. Remember that knowing is not enough. We must apply. Willing is not enough. We must do. Thank you so much. Do not hesitate to call the IV Admixture Unit Officer, Dr. Ahmed Khayat, or any of the IV pharmacists. Thank you so much for your attention.